Hello, I'm Heidi Eisen-Lusberg, a licensed clinical social worker and Radically Open DBT senior clinician and trainer. A frequently asked question that I get, what is Radically Open DBT? Well, RODBT, as it's also called, is a behavioral therapy. It focuses on behaviors, specifically the behaviors that might be getting in your way or keeping you stuck from having the life that you want to live. So together we look and learn about old behavior patterns that might be getting in your way or keeping you stuck. We want to know where, how, and with who do these problem behaviors exist. We then investigate the pros and cons of the behavior. What are the consequences and reinforcers? What keeps the behavior going? How does this behavior impact your relationships? What about your daily life? And is this behavior getting you closer to or further away from the person you want to be? Next, we try out new ways of behaving using the RODBT skills. These skills are taught and practiced in every session, as well as in the skills class, which offers 30 weeks of learning and practice in a supportive community setting. We challenge the old thoughts, beliefs, and stories that might be keeping the behavior going. We do this through a process called self-inquiry, a mindfulness practice. And last, we develop new behavior patterns that replace the old, new ways of living and relating. And so how does this actually work? Well, change happens in RODBT with new behaviors, which create new experiences, along with new thoughts and feelings, renewing and enhancing relationships, leading to psychological health. And what exactly does RODBT help with? Well, it's not necessarily about a diagnosis. RODBT was developed to help with temperaments and coping styles of over-control. A temperament or coping style is not about a symptom. It's more about the way a person lives their life, how they interpret information, react to situations, and relate to others. You can see in this diagram here that there's a range of under-controlled to flexible range to over-control. And what we're learning from the research is that there's strengths and challenges at both ends of the spectrum. Psychological health is available for all of us in this flexible range. So in RODBT, I work with my clients who identify as over-controlled and help them learn ways to be more flexible. More specifically, these are the types of behaviors that are related to over-control. So oftentimes, I see with my clients desires for order and structure, distress or difficulty adjusting to unexpected change, difficulty forming or maintaining close connections, conflict or disconnection in relationships, indirect or ineffective communication patterns, difficulty reading, relating, or responding to social cues, social anxiety and isolation, chronic depression, feelings of loneliness and lack of belonging, avoiding new people, places, or things, trying to control other people, or trying to control the outcome of situations, noticing all errors and wanting to fix them. Hyper-perfectionism is common, redoing work or being really hard on yourself or others if things aren't done the right way. Obsessive thinking, such as planning, researching, ruminating, and worrying. Compulsive behaviors like working, overachieving, sorting, cleaning, over-exercising. Restrictive diets, such as eating disorders and anorexia, ARFID, and orthorexia. Oftentimes there might be a sense of secret pride, or maybe even arrogance, or resentment and bitterness towards unfulfilled expectations in life and relationships. Perhaps even some self-loathing or regret. Sometimes my clients have urges to injure themselves, usually in private. And sometimes my clients have suicidal thoughts, which are usually secretive. And before we begin our work together, we come up with a plan and an agreement that they will not act on these self-injury urges or suicidal thoughts so that we can gain the most out of the therapy experience together. So what is the RODBT program? Well, it consists of individual therapy and skills class. The individual therapy are weekly private sessions of 60 minutes with your trained RODBT therapist. The objective of these meetings is to target the overcontrolled coping and maladaptive social signals or behaviors, and to provide an environment where you can practice flexible responding and more direct communication. In skills class, we meet weekly for 90 minutes, and we cover 30 RODBT skills. The objective is to learn radically open principles and skills with a supportive community and to form and practice new ways of living, communicating, and relating to others. All protocols and interventions and skills we use are based on a researched curriculum that is used all over the world with great success. In fact, the results are in. Research has shown repeatedly that RODBT participants experience improvement in their mood and anxiety, an enhanced understanding of self, closer and healthier relationships, increased psychological flexibility, a better sense of belonging, and decreased overall distress. So if you are ready to be more flexible, open, and connected, I encourage you to contact us today.